Hello, this is Martin Tierney from Seating Matters, and I want to talk to you today about a new development that we have at Seating Matters that is going to change the way pressure care is provided in seating. We focus a lot on clinical research and the evidence base behind the chairs that we provide for people with a range of disabilities. In particular, pressure ulcers is an area that we spend a lot of time focusing on and creating solutions for. In the Clinician Seating Handbook, the book published by Martina Tierney, Occupational Therapist, it details some of the evidence base that there is around degrees of tilt that are used for patients who either have pressure ulcers or have a high risk of pressure ulcers. This research shows that the higher degree of tilt a person can tolerate, the better it is for repositioning, for offloading areas of bony prominence, for example the pelvis, and for increasing blood flow under the ITs, under the ischial tuberosities. So 45 degrees of tilt is an angle which will provide an effective weight shift, which will allow a person to sit comfortably for a longer period of time and reduce the incidence and the risk of pressure ulcers or pressure injuries developing. It's common for chairs around the world to have 30 degrees of tilt, and the research shows that this is an effective position for improving function and also to provide a degree of repositioning. But if a person has an existing pressure injury, or if they're at risk of developing a pressure injury, 45 degrees of tilt is a much more effective position to give offloading of the pelvis and to reposition the patient. Here's some of the evidence to support that. Sonnenblum and Sprigel said in 2011 that pressure reduction at the ischial tuberosities occurred when the degree of tilt was 30 degrees and greater. Jackie Casey, Gittins et al. In 2011 said that tilting as far as the seating system permits maximizes the potential for significant blood flow increases and pressure reduction. And a further study said that seat angle of 45 degrees and a back angle was an effective weight shift position. We've taken this research and this evidence and we have used that to influence the design of our Phoenix and Sorrento chairs to give 45 degrees of tilt. Now this isn't for everyone, but 45 degrees of tilt should be used for people who have existing pressure ulcers, pressure injuries, or who are at high risk of developing pressure ulcers or pressure injuries. If you would like to see a 45 degree tilt chair in action, have a look at our website. You can see really good videos of that chair being used, or if you would like to try one out in person, one of our seating specialists would be happy to bring that chair to you and let you try it out and use it for some of your patients. Sharing clinical research and sharing knowledge is the only way that we can improve patient care. If you found this video useful, please like and share the video with your colleagues in your workplace or with other people who may find this of interest. You can also get in touch with Seating Matters at contact@seatingmatters.com.